So here's some of the reactions that people are getting from the healthcare CEO assassination. And there's a lot of mixed tensions. Because you see a lot of celebratory things about how this guy got what he deserved, how the CEO was such a rat bastard to so many lives. And I understand the sympathy of that. And just like we explained before, it's not about the murder that people are reacting to. It's the fact that what this case involves is the representation of everyone's collective anger and frustration of the private healthcare industry that is purposely, intentionally screwing over people. And I think that's what a lot of people miss in the reaction to this. Many people are missing that initial perspective to, again, focus on the murder, which is not the point of this. It's not the point of this. I don't agree 100% that guy should have been assassinated. That's not what I'm saying. I'm saying that I understand the collective anger of people that were denied their health care and the frustration and anger of people's lives that were damaged by groups like UnitedHealthcare. So here is Ben Mulroney, who is a Canadian kind of celebrity. He's like our own Ryan Seacrest. He is the son of former Prime Minister, the late Brian Mulroney. And he's hosted shows like E-Talk and CTV Morning, and he did Canadian Idol for a few years back in the early 2000s. Now apparently he has a radio show. He's apparently doing a national radio show on Chorus Entertainment Network and on the AM dial. So definitely our grandparents know who this guy is. Because I don't know anyone in my generation that bothers to even touch AM radio. Except for maybe me, because that's only for traffic. But here's Ben Mulroney. He tweeted this out. So he says, following the glee and joy on social media after the assassination on the streets of New York City of a healthcare executives, we're going to ask the questions we have as a society. As a society, lost our moral compass? And here, this is him promoting his radio show after seeing the frustration of people dealing with UnitedHealthcare, after people explicitly, and especially on social media, I mean, you go onto X right now, you could see a flood storm of people expressing their anger and just the absolute atrocity of UnitedHealthcare. And Ben Mulroney just completely mindless to it. But listen to this.
Ben Mulroney here on the show today. We're going to look at the psychology of the New York City shooter, and we're going to turn things around and look at the glee and the joy and the outpouring of support for this person on social media. And we're going to ask ourselves, have we as a society lost our moral compass? That and so much more today on the Ben Mulroney Show.
I love how he's going to bring up psychology in this. Psychology. Have we as a society lost our edge because we're championing a murderer? First of all, considering we're a society that pedestals a lot of serial killers, I mean, how many documentaries have we seen about Ted Bundy and Jeffrey Dahmer on Netflix? How many documentaries and true crime dramas have we seen amplifying killers? So that's already out of the picture. And again, he is losing touch with the fact that this is not about the murder. People are not gleeful about the murder. They're gleeful at the fact that people are understanding the collective resentment and the anger and frustration of UnitedHealthcare CEO's practices. And this guy completely does not understand that. Maybe it's just too much hair gel that's going to the brain. And since we're talking about psychology, does he mention about the psychology of why insurance claimers are denying people, even though they pay out of pocket to these insurance companies for healthcare, and they're denied healthcare? Do we look at that psychology? Do we look at nefarious ghouls that laugh on you being on your deathbed in a hospital? That your doctors, that your nurses, that your surgeons are telling you need necessary surgery and you're denied claims? How they purposely manipulate people by changing the legal terms of their insurance policies so they purposely deny their claims. Purposely. Does he mention this in the radio show? No. No. Absolutely not. So that's where I came in. I retweeted him and I said, try to imagine the glaring fact the simple CEO was responsible for the sinister practices that led to hundreds, if not thousands, of claim denials and even deaths under the false promise of healthcare. I know we are both Canadian, Ben Mulroney, you and I, but would you give up your public healthcare here in Canada to go deal with head-on with the United States nefarious private insurer that diabolically doesn't give an F about you, period? That's what I'd be asking Ben Mulroney. That's what I'd be asking him directly. That you want to feel sympathy and feel awful for this simple CEO? Oh, because he's a healthcare executive, I feel so bad for him. I feel so bad. He's a human being. I see so many people. He's a human being. So was Adolf Hitler. So was Osama bin Laden. So was Saddam Hussein. So was Bashir al-Assad. So was Vladimir Putin. So was a lot of people. And trust me, Brian Thompson has a lot more on his hands, blood and all, than Luigi Mangione. And look, I'm not happy with the murder, but that's not the point of this. The point of it is the fact that private executives, the private insurance company, is scamming people. It's a mafia determined to diabolically take your money and deny you health care, which is exactly a heinous practice that needs to be investigated, that needs to be brought to attention more. And unfortunately, in America, the only way to bring attention to this is sadly with an assassination. That's sadly what the world has come to. We have to have an assassination to finally have a discussion on why private insurance is so awful. Even though everybody from the left and the right knows how awful and outrageous it is. But you still got individuals that are coming up with these ridiculous claims. So here is a Canadian woman who's about to explain to someone like Ben Mulroney exactly why people had this gleefulness about the recent assassination of the healthcare CEO. And again, it's not about the murder per se, as it is about the situation that brought to the attention of this murder. So listen to this. Oh.
I want to read you a claim denial letter from UnitedHealthcare that was just posted to Twitter. I'll show the original tweet first, and then I'll show the brightened up response denial letter itself so you can read for yourself what the insurance company said when they denied an elderly woman's claim after hospitalization because they didn't think it was necessary, even though the doctors did think the hospitalization was necessary. I can't make myself smaller, so I'll just hang out in the corner over here. You can see this poster's 62-year-old mom passed out, hit the floor, was blue and ice cold, had a seizure. The ambulance arrived. Her blood pressure was 88/44, and then it spiked to 200/160. She was taken to the emergency room, and doctors felt it was necessary for her to be admitted to the hospital for 4 days. Now, let me read to you the letter that UnitedHealthcare sent her, denying her claim after she'd already been in the hospital. The clinical reason for the denial is, you were admitted to the hospital on September 14th, 2024. The reason is passing out. We read the medical records given to us. We read the guidelines for a hospital stay. This stay does not meet the guidelines. You did not have to be admitted as an inpatient in the hospital for this care. The reason you were watched closely in the hospital, the reason is that you were watched closely in the hospital. You were stable. You had tests that did not show any problems that needed inpatient-only treatment. The records showed that you did not pass out due to a heart issue. You could have gotten the care you needed without being admitted inpatient at the hospital. The hospital inpatient admission is not covered. We let the hospital know it's not covered. Then it lists out that the services were not covered: hospitalization, acute inpatient admission, and then the dates determined not to be medically necessary. This is the reality of privatized healthcare. You know, I don't know what fantasy world Canadians who think privatization and insurance companies are going to help when literally the only reason they exist is to create profit for shareholders and executives. That's it. How do they do that? By denying claims, by overruling doctors. Obviously, a doctor thought that her inpatient stay was medically necessary. It's an emergency situation. She's admitted. You can't wait for months. Actually, that's why 45,000 Americans die each year. It's directly attributed to delays in.
And who are you going to trust more? The doctor who's actually at the scene helping you as a patient who knows about your family record? Or are you going to trust the insurance company who's sitting behind a cubicle reading a script to you telling you, too bad. So sad. Sucking on a lollipop. Who are you going to believe? Who are you going to believe that needs the assistance? Now you understand why people got upset at UnitedHealthcare.
Treatment due to insurance approval delays. And you see the tone of that letter? Okay, that's something that, now that I've lived in Canada for 5 years, shocks me. That's very standard in the United States in terms of like how blunt and direct people and companies are to each other. But like having lived here for so long now in Canada, where there's so much politeness and respect coded into like everyday interactions, it's really shocking when you see the way that they talk to their own customers. So if that's what you want, you know, you can go live in the US, I guess, give it a spin, see how much you like having. I'm sure that bill was like at least $100,000.
So where's the moral compass, Ben Mulroney, on that? Where's the moral compass to the fact that a doctor who was at the scene, who knows this woman needs to be hospitalized, that she did collapse, that she did have an increased heart rate, that she was necessarily needing health care, and the insurance company that's in their office that doesn't see this happening and is reading this purposely denies it and using verbiage like some sort of cartoonish villain. I could see that you didn't need the health care. You didn't need the hospitalization. What about that moral compass, Ben Mulroney? Let's talk about that moral compass. Let's talk about the fact that UnitedHealthcare is the top contributor of thousands upon thousands of insurance denials that leads to people's deaths. Again, who has more blood on their hands? The 26-year-old who seems to be a very intelligent spook maybe for the agency? I don't know. That's suspiciously could be the case. Or the healthcare CEO who purposely denies claims that allows this to continue on. And again, you wonder why people on the left and the right gather together in Yotai spirit on the fact that they all hate private healthcare insurance. And again, I say to Ben Mulroney, if you feel so bad for the private healthcare executives and feel bad for this industry, how they're getting brutalized and attacked, where's our moral compass? Then by all means, go get some. Go get some U.S. health insurance. Cancel out your Canadian status. Go get some insurance and try to deal with it. Try to deal with it when you get sick. Because the people that say otherwise, the people that are in defense of these private institutions, have never, ever actually had to deal with illness, have never actually had to deal head on with these scumbags. And the people that constantly do the rhetoric, they do the tiptoeing dance of, oh, you want the government to be responsive of healthcare? At least I can fight the government. At least I know when our healthcare is deteriorating here in Canada, it's easier to fight the government than it is to fight a private conglomerate of private insurers. Because they have a bunch of lobbyists. They have a bunch of lawyers. They're going to pummel your ass if they try to do this. Just like pharmaceuticals. Just like any big corporation. That's why you need a safety net for the general public. Because otherwise, you're going to get squashed like the private insurers did to this woman. That's why it's necessary. You have basic coverage for everybody. You have a level playing ground. And it's not government run. It's your tax dollars being invested into a program that insures everybody. Everyone gets to be in part of a same insurance plan. If you want more of that, if you want a more gold-plated insurance plan for you and your family, then by all means you can buy into private health care. But for majority of the people, this is why it's such a huge win, a polling win for Medicare for all, is because people all agree that we need the necessary basics to treat everybody. That the only way for America to survive and its people is to have universal basic coverage so they have a fighting chance. And that's why so many people of Democrats, Republicans, and Independents all agree with it. But Ben Mulroney, what about the moral compass of people? How dare you? Anyway, we should finish the rest of this video.
If not more. You can look at any medical bills on Reddit. There's whole subreddits devoted to understanding medical bills, fighting medical bills. It's conservative to estimate that, a one-day stay in a U.S. hospital is between $20,000 to $30,000. Yeah, so, if you want to go to the hospital and the doctors think it's necessary only to have your insurance company say, oh, we looked at your records and we looked at the guidelines and decided we're not paying for this, you're fucked. If you're poor, you can get charity care, which I had been through before in my early 20s. But if you're middle class or rich, you're stuck with that bill. And it's why 42% of Americans carry medical debt.
So there you go. That's the sad reality, and that's where I share the sympathy and understand, because like that woman reported there, and like I've seen so many times before, I understand the collective anger and the resentment and just the distraught of these private insurers that purposely, diabolically do this to people. Because, again, they're not there for healthcare. They're not there for healthcare. Just like how pharmaceuticals are not there to treat you and care for you. They're there to make profit. They're there for the longevity. So they're going to profit off of your death and disparity. They're going to profit off your illnesses. They're going to profit off and gamble on your life and hope you don't die. That's the only thing they got for you. Well, you need necessary surgery to live, but according to our guidelines, that's going to, inflate with our budgeting. And since I already bought a Maserati, you can go pound sand. Even though doctors, nurses, people within the hospital, general surgeons, all agree that that person needs surgery. But apparently us people, according to Ben Mulroney, we're the ones that need a moral lecture. We're the ones that don't care for lives. We're the ones. Did we lose touch with moral compass? Or did Ben Mulroney not understand the pain and pressure because he's a spoiled little trust fund kid, just like Justin Trudeau, our prime minister, the son of the former late prime minister Brian Mulroney, and he doesn't have to deal with any of that. So, like I said, by all means, if you think that UnitedHealthcare insurance CEO was wrongfully, stated and people are attacking him for no reason, then by all means, go towards a private insurance. Go towards the U.S. healthcare. See how it works out for you.